Have you ever been curious about the nervous system, how it travels through the body, how when it perhaps develops pain in our body, where it is that's the onset of that pain? So if I feel a hand that has some pain in it, is it actually in the hand and the wrist itself? Or do we find it in another area as the nerve travels through the pathway to perhaps promote that pain? So I wanted to share with you, those of you who've been curious to, can we actually touch a nerve, and can we get more precise with the nerve itself inside the body, that the Neuromeningeal program that is offered through the Barral Institute has to share with you. It's going to increase your palpation skills to know how the nerve travels through, if it's a peripheral nerve, if it is a cranial nerve, it's the anatomy to where it exits into the foramina of the cranium, or the exit points that we can touch them as manual therapists to make a difference on perhaps some diagnosis like trigeminal neuralgia, chronic headache syndrome, TMJ, if it's ruled out that it's not the disc or not the joint or the muscles around it, perhaps it's a referred pattern. So we want to get to know the nerves. And then in discovery, besides the central nervous system and the peripheral nervous system, Jean-Pierre has discovered the autonomic nervous system and how he can touch into that and make a difference in the actual behavior of our organs, the physiology, motility of the organs, the sympathetic, the parasympathetic system, from an actual techniques that we've learned in the Neuromeningeal program. So coming in and understanding, can I actually touch them? Can I make a difference? Can I be precise and specific in a nervous system rather than from the outside environment coming in? We can make a difference perhaps in the listening skills that we have going into the deeper but very important and powerful, gentle approach that the Neuromeningeal program has to offer.